When I started 30 years ago, there wasn't any recycling. It was just a matter of throw everything into a clean sack, went down the chute, which went automatically into a compactor, away it went. So no one knew what was in it or even cared what was in it, basically, to be honest.
Out of sight, out of mind, wasn't it?
Pretty well much, yeah.
We were certainly aware of the wastage because we produce a lot of it. We're very much aware of what we produce on a daily basis in terms of saline bags, oxygen masks, PD bags. We hadn't thought about recycling, and so when they came to us, staff and myself were very keen to be part of the pilot because we were aware of what we produced on a daily basis and often talked about it.
What makes this program successful is having the involvement and the support of the executive, of the nurse unit managers, of the clinicians, including anaesthetists, surgeons, physicians and other doctors, all of the nursing staff, which are just so integral, and the environmental services staff.
So there was a group of clinicians that were really keen and enthusiastic about implementing the PVC recycling at Dunedin Hospital, but we weren't sure how to do it. So we needed to contact someone in senior management, and I got hold of Cherie McConville, our Director of Performance.
I saw this as a great opportunity, so I ran with it along with Craig and the rest of the team that we put together.
That project group consisted of the orderlies, who were key for the distribution of the PVC recycling. We needed procurement involved because they send the PVC products throughout the District Health Board. We needed clinicians involved because clinical champions were going to make this work, and we need clinical champions in the areas. And we needed management to be involved because there were potentially contractual aspects that the clinicians weren't aware of.
We had clinical champions, so people in the areas who really were passionate about this program. They were there right beside each of the staff member in each area, walking alongside them, saying, this is working well, this isn't, what can we do about it, how can we change things? It all ran really smoothly.
It's more about having people that are enthusiastic and can drive it, and understanding within your own organisation who can make that happen. Keep your group small and just spread that enthusiasm, I guess is the main thing I would say.
I'm often telling people that recycling is a journey. You will have hiccups along the way. You will go off the rails slightly, but it's really a matter of being dynamic and responsive to those changes and attentive, having green champions and people who are interested in the program to keep it going.
So one of our other experiences with the pilot program was we found that those areas that had, I guess, more predictable workloads, the program was a lot more successful. So my advice from our experience here would be to start small in an area that is confined and able to be managed more easily.
The easiest way to do it was disposal at point of use. So we just simply put out some plastic waste paper baskets that were lined with a plastic bag and labelled PVC, and instead of dropping material into a rubbish bag, it would get dropped into that the PVC recycling container at the point of use.
So we initially had a lot of issues when we were auditing the waste to make sure that the ID labels were taken off and the sharps were removed, the metal was removed. Initially, no, you would say there was a lot of contamination of that waste. So some of the things that we did was we made sure that there was scissors beside where the waste was, so that helped them remove the bits that they had to. The signage was looked at. We said to them, well, actually, if you can't get this right, we can't continue recycling the PVC here anymore. So they didn't like the thought that we might actually be taking it away from them. So yes, after that, the compliance improved greatly.
So we're a matting company making our product from recycled PVC. We need good, clean material. If the material's too dirty or has lots of labels or the giving sets or other foreign matter in there, then basically just blocks our machine, and someone that's not doing it right kind of ruins all that good work from the people that are doing it correctly.
Everyone is just a link in a chain, and everyone has a job to do, starting with the medical staff in the wards by turning around and separating it for us, and then the orderlies picking it up and then bringing it down here.
When new members start here, it's really part of the orientation process here. They walk out here to recovery, they see what we're doing, we show them how to do it. They can see that we're quite passionate about it. The number that walk in and say, wow, this is fantastic, I wish they did this elsewhere.
It's all of the clinical areas that are driving this. They're really passionate about it, they're doing it on a daily basis, they're maintaining it. It's just part of the everyday of what they do now.
We've done the hard yards, but everyone who takes up the program hereafter will find it much easier because the resources are in place and we've learnt the teething problems, and it really is a very easy program to take up. So clinicians obviously care about their patients and the environment. With the PVC recycling program, they can now care about both.